Welcome to The Nation. I'm Jessy Chahal. On today's episode, I'm joined by Dr. Ashley from the National Cancer Society Malaysia. She's here to explain how heart disease, diabetes and kidney problems, which often affect families in different ways, are more connected than we realize. Together, they make up what's known as the Cardio-Renal-Metabolic diseases, or CRM, and a growing health challenge happening right here in Malaysia. Welcome, Dr. Ashley. Thanks for being with us, and I'm glad you're here to highlight what is known as the silent trio. Give us an understanding of how this disease is perhaps maybe, and not many people realize, but they're so closely related and linked.
Thank you, Jessy. So when we talk about cardio-renal-metabolic diseases, we're really talking about three conditions that are deeply connected. So we're talking about cardiac disease, heart disease, and then renal disease, which is kidney disease, and metabolic disease, that is diabetes. So these three things don't work in isolation. When one thing goes off track, the other would follow as well. So for example, if you have diabetes, you are more prone to develop kidney disease and heart disease. And if you have heart disease, you're putting on an extra strain on your kidneys on a daily basis, so you're more prone to having kidney damage and subsequently kidney disease. So as you can see, it's a bit of a vicious cycle. And these three conditions, we call them a silent trio because they really are silent, especially during the beginning stage of these diseases. A lot of people won't have any symptoms, so they won't get checked. So that's why it's very important for us to tell the people out there that even if you feel fine and you're young, you don't feel like you need to get checked up on, you do need to get regular health screening. You really need to know what your current baseline status is. What's your blood pressure reading? What's your sugar level is doing? What's your kidney function is doing? Because all these things, these CRM diseases, are preventable, and if it's detected early, we can either reverse it or we can reduce the risk of complication.
I like a few things you said, that it is preventable and that, of course, early and regular health screening is important. You recommend that happens on a yearly basis?
So for first-time user, you can do yearly. And then if you've done it yearly and you notice that I'm actually quite good, you know, I'm doing a good lifestyle as well, then you can do every 2 to 3 years even. It's just that we don't want anyone that never done any health screening and then suddenly hit with a really bad diabetes.
Right, and that's what we're really trying to highlight in our discussion today, the components of not just understanding blood pressure, your BMI, and also to know what your blood test readings are, the fact that lifestyle also contributes such a big part to the overall presence of the silent trio. Many a times, as you've highlighted as well, that it does not have symptoms, and so it creeps up on you. Because how many times have we heard friends and loved ones come up and say, well, this has happened to me, I'm going through this, and say, but you look really healthy, so on and so forth. Now, based on an article that I came across, it talked about the CRM disease market, and unfortunately, in a way, that's projected to grow significantly from $290 billion from last year to $451 billion in about a 10-year frame or time frame. Now this reflects both the rising disease, its prevalence, and the rapid innovation as well in terms of treatment. So from a public health perspective, doctor, what does this trend tell us about the scale of this on a global level, and how does Malaysia fit into this picture?
Yeah, so from a public health point of view, the numbers are quite worrying. So to put it into perspective, globally in, let's say, 30 years ago, 1990, there's only 200 million people affected with diabetes globally. And that number has come up to 800 million people in 2022. And then we can see that the kidney disease is, one of the fastest cause of death that's happening globally as well. And globally, the rate of obesity has doubled since then. So, both developing countries and developed countries are showing the same trend. And Malaysia fits right into that global picture where, 1 in 2 Malaysians are overweight or obese. And that number has, increased by 22% from the year of 2011. And as we know, being heavier and bigger does carry risks for developing CRM diseases that we talked about just now. In terms of medical innovation, yes, we're in 2025, so everything is at its best. You know, we can detect earlier, we have better diagnostic, we have better treatment options, pharmacotherapy and things like that. But we really also need to put as much focus on prevention. So when we talk about prevention is lifestyle, so lifestyle choices. We really need to make it to the people that it's important to get yourself screened regularly. It's important to get moving, eat healthier option, and also to create environment that makes it easier for people to choose healthier options.
Right, of course. I want to come to the health screening process. Perhaps there's a misconception that it's a long process. It takes up a lot of time, and the cost factor as well. Could you walk us through how simple a health screening procedure can be?
Okay, so to get a comprehensive health screening, usually you would, you always have the option to go to government clinics or private clinics, okay? You just say you want to get yourself checked. And usually it starts with the nurse or the doctor seeing you to look at your, to measure you, blood pressure reading, your BMI and waist circumference as well. Once we get these, these numbers, then we go with doing a comprehensive blood test. And these blood tests will include your full blood count, your kidney function, your liver function, your cholesterol, your sugar, your uric acid, and after that it will be a urine test. Urine test is important because it can detect early signs of kidney damage. You can see the presence of protein or sugar or glucose or blood in your urine that may suggest that you might be developing early kidney damage.
When we look at the stats as well, Malaysia records some of the highest rates in terms of CRM diseases or CRM related diseases. From your observation and through your experience as well, what do you think is the main drivers that is affecting Malaysians so badly?
So according to a joint report by WHO and our Ministry of Health, we see that up to 72% of premature death that's happening among Malaysian men and women are due to non-communicable diseases like CRM diseases. So it's very scary to look at that stats. There are a few factors that's caused this. The first is lifestyle. We are heavier, we are bigger, our food are saltier, our drinks are sweeter, high calorie diet, we are more sedentary, a lot of us are still smoking. So these are the major factors in terms of lifestyle. Secondly, it's our own lack of awareness and late detection. We feel we're fine, so we don't feel the need to do a regular health checkup. And thirdly is socioeconomic and cultural factors. So we are, we're busier. We don't have the time, we are juggling work and family, we're stressed, and we're more chronically online. So we tend to believe what we see online more. So that includes, receiving unverified advice, health advice and health supplements advice as well. So these mixture of things is what's driving the problem.
Now, if you look at stats, it shows that 1 in 5 adults in Malaysia are at risk of higher risk of disease, yet many remain undiagnosed till it's a bit too late, as you pointed out. Why is there so much of unawareness especially if someone already knows that there could be something wrong with them or has recently done a blood test and something has flagged up? And what are some of these barriers that contribute to this late diagnosis? We also spoke a little bit about knowing that you've got a blood test that's not quite looking, in the pink of health, yet they're not doing anything about it after, thinking maybe, I could reverse this on my own. And I mean, that is something that has probably even gone through my mind. So it's regular human behavior, perhaps.
So the reason, because we call it a silent trio for a reason. You don't tend to have symptoms, or you might have symptoms, but it's very subtle. So it tends to be perceived as normal. I'm okay. And then one of the barrier is that our own attitude towards health. As a Malaysian, we are more reactive and not so proactive, so we only see doctors if there's problems. And secondly is the practical issues. There's a lack of health education and misinformation. So And also we need to think about the accessibility as well, especially in the rural and remote area, people that's undeserved and underprivileged. The cost of healthcare services is higher as well, the long waiting time in clinics. So these are the factors that, kind of make late detection. It's quite prevalent in Malaysia.
Well, Doc, I'm just going to hold your thought then.
Yeah.
We're going to take a quick break. We'll be back with more. Don't go anywhere. You're watching The Nation right here on Bernama TV. Welcome back. Thanks for joining me right here on The Nation. I speak to Dr. Ashley from the National Cancer Society Malaysia, where we are looking into and discussing really the prevalence and the rise of what is known as CRM. That's the Cardio-Renal-Metabolic diseases. It is named or called often a silent trio without much symptoms until it gets a little too late. Doctor, before the break, we spoke about the stats that this can affect 1 in 5 adults here in the country as well. But CRM diseases are known to share common pathways in the sense that it shows up firstly maybe with inflammation and insulin resistance and vascular dysfunction. How does this overlapping complicate the situation even further?
Yeah, so you're absolutely right. Because they share common biological pathways, the signs and symptoms, the way they present can be overlooked, can be very subtle or mixed, so that's why in primary care settings, as a doctor, healthcare professional, when we see patient with one condition, we don't just treat one condition. We want to look at the patient holistically. We want to approach patient in multidisciplinary team effort. And this will benefit patient in getting coordinated care to reduce the disease progression, and then they can improve their quality of life because it's all integrated. As I mentioned earlier, if you have diabetes, you're at risk of getting a heart disease and kidney disease. And people with diabetes, usually they don't die from diabetes. They die from heart attack or stroke or kidney disease. So that's why it's really important to look at this whole thing together.
Mm-hmm. Now, what are some of the early indicators? I know you mentioned before that despite it being known as a silent trio, it could show up in a few different ways, but early on it may not have any signs. What could be some of those early indicators or otherwise warning signs that show up?
Sure. So for diabetes, for example, so you really need to look for signs like increased urination. You're peeing a lot more, you're feeling more thirsty, you're having recurrent infections, so like a skin infection or urinary tract infection, and you're feeling tired, unexplained tired. You're tired more than usual. So that's for diabetes. And for kidney disease, you would look for signs of increased swelling in your hands, in your feet, around your face, around your eyes as well, if you're looking a bit more puffy than usual. And also you need to look at your urination. If you're peeing a lot more, and if you look at your urine, it's a bit of a different color persistently, and it's frothier than usual, it might suggest the presence of protein in the urine. And that's for kidney disease. And for heart disease, you may experience the unexplained short of breath, unusual short of breath, unusual chest discomfort, especially when you're not doing anything, sitting at the office and suddenly you feel some discomfort in your chest, and you're feeling again unusually tired, especially when you've done a physical activity.
Yep, but feeling unusually tired and having a little bit of, soreness here and there, a bit of swelling sometimes, we blame it on our lifestyle, lack of sleep, and, I've eaten something, it's made me feel bloated, and so on and so forth. I just wanted to go deeper into lifestyle factors. Also, of course, when we speak of lifestyle, we think about our diet, what we are eating, how we're sleeping, the habit of smoking, and our physical inactivity due to sitting in front of the PC or driving for long hours and on all that. This is often cited as causes. Then there's a school of thought that says, well, it doesn't run in my family, heart disease doesn't run in my family, so on and so forth. Is this true that if it doesn't run in your family, you're less at risk? And has sort of the dynamics of these diseases changed?
Yeah, so genetic, family history and lifestyle, they play such a huge role in the development of CRM diseases. But in Malaysia, we notice that lifestyle choices make a bigger impact. Okay, so these are the drivers that gonna make you have CRM diseases. Having a genetic family history is like a genetic predisposition. They can make you more susceptible in developing these diseases, but it's what we do on a daily basis, our daily habits, you know, the calories input and the calories that we exert out. These are more important and the main drivers as to why we have such a high NCD, non-communicable disease and CRM diseases in Malaysia. So we really need to look into these risk factors and know ourselves well and try our best on a daily basis to prevent.
Right, and just on this particular screen and this image that's running through, we look at fruit servings, we look at its effect on age group, but also, does it affect more men or women equally, or is it more, is one species more at risk?
It tends to affect both men and women. And also, if you look in a household, who's doing the meal? So if the woman is not preparing, fruits and veggie, the men will be affected as well. So it tends to affect both genders in Malaysia.
That's right. So it goes back down to what is our lifestyle like, and where or what risks are we at which point of our life. Age, is that a factor as well? Yeah.
So as you grow older, it's one of the non-modifiable risk factors, same like family history, something that you can't change. But you can definitely, whatever it is, if let's say you are destined to have CRM diseases, what you do now can actually slow the disease progression. The aim is to reduce the risk of complication and premature death.
I want to come to what you mentioned earlier. We are online a lot and we are susceptible to a lot of content that unfortunately at most times is now AI generated and serves into the areas of misinformation and disinformation. What of supplements? Because there's a lot of promises or fake promises out there. It can help you with your kidney, it can help you with your liver, good for your heart, so on and so forth. Some are, they promise all sorts of magic. So what would you like to say about supplements?
I always tell my patients, okay, so you can go on supplements after you've done the screening and everything is fine. You can go on supplements. Supplement is a supplement. It's not tend to reverse anything, or it's not tend to manage a chronic condition that is CRM diseases. So it's different if someone has a really high cholesterol, but I'm going to take some supplement to see if it brings it down.
Yeah.
It won't. It may help a little bit, but it won't necessarily reverse everything. So you are at the moment you're trying the supplement, you're putting yourself at risk actually to develop sudden heart attack or sudden stroke. So you really have to be careful, and you really need to talk to your healthcare professionals. What's the best course of action that you should take?
And speaking of talking to healthcare professionals and getting that extended helping hand, the National Cancer Society is running a community initiative called Saring at Community that's offering free screening for underprivileged groups. Tell us a little bit more about this program and how it's come about.
Okay, so Saring at Community is an initiative run by the NCSM, fully supported by Boehringer Ingelheim, where we offer a free and accessible comprehensive health screening to the underprivileged communities. And we target to screen about 5,000 people by the end of this year. So this comprehensive health screening will include the, checking the BP, BMI, waist circumference, and offering blood tests and urine tests. But also it includes teleconsultation. Our doctors will speak to the participants about their results, and it also includes a follow-up care. And it's the follow-up care is very important. This initiative is to, it focuses heavily on CRM diseases, and it recognizes how chronic kidney disease has become one of the fastest cause of death globally, including Malaysia.
So you mentioned follow-up care. Let's go a little deeper into that. What do you mean by follow-up care, and why is it important?
Okay, so continuity of care is important. A lot of people do health screening, and if it's abnormal, they tend to stop there. And there's a lot of factors, the reason why they don't go for a follow-up care. First is, fear, denial, or even they don't know what to do, where to go next. So in NCSM, with the Saring at Community initiative, we have this CRM information services hotline. So we have officers that sit in the office and they do a follow-up ring, like a phone call or email or WhatsApp reminders. They follow up on these participants that's got abnormal results, and they say, have you gone for your treatment? And if they say, I don't know where to go, where do you live? Let me find out where's the nearest government clinics that you can go to tomorrow. You know, so they guide them step by step, and then 2 weeks later they ring them up again and say, what's your treatment, how's everything doing? They don't only stop there, they also offer lifestyle and behavioral intervention, you know, so based on your blood test everything's fine, you're just a little bit overweight. So can we talk about that? What can we do, you know? And they're really good at discussing with the patient in terms of, you know, doing something that's sustainable, because we don't want short-term solutions.
I think that's really helpful and important, and perhaps where the issue lies, where people just sort of fall off the bandwagon of not following through and going through that last mile of getting the medical attention and advice that they need. Now, this is of course here in Kuala Lumpur, the campaign. Is it going to go and expand out of KL to reach more communities?
So at the moment, we very much want to focus within Klang Valley area, because we want to make sure that the program runs smoothly. We want to make sure that the participants get the best care, and we want to see if there's any on-the-ground challenges that we need to tackle if we were to expand it to the other states. At NCSM, we're really looking forward for collaborating with any organization to really expand this initiative to the other states as well.
You know, we've heard of campaigns time and again, and it takes a lot of hard work behind the scenes and initiatives by all sorts of agencies to put forward something that is truly life-changing or healthy for people. What strategies do you think have proven to be most effective when encouraging Malaysians to take up screening seriously?
So before we go into a community, we kind of do a big background search a little bit. So what works in the community, what doesn't work, you know. But quite often and almost always when we do community outreach program, we do it on the weekend because, you know, people are not working, so that will increase participation rates. So that's one of the strategy. The second strategy that we find also very effective is to include the local leaders. You know, people like to be led by example, so we would do a little bit of a ceremony, opening remarks from the local leaders, and we'll do a bit of a health talk, and then get the local leader to start first. And you know, people
lead by
that.
example.
Correct, yes, and people like that, and we can see a high rate of participation.
Nice. Now, finally, for our viewer watching today, how can they get involved, or how can they find out more about Saring at Community, whether it's for themselves, families, loved ones, or even their communities at large?
Okay. So at NCSM, we have identified places and communities that we want to go to and offer Saring at Community. But if you feel like your community deserve it and you really want it, do give us a call and give us a suggestion. And also for the general public, we're really looking forward to have more volunteers to run these initiatives on the ground smoothly. So check out NCSM website and our social media channels to see how you could participate as a volunteers.
Well, this is a community message and reminder to reach out to your friends, family, loved ones, and within those in your community to remind them and share with them the fact that medical advice and health screening is available at a nearby location. Thank you very much, Dr. Ashley, for coming in and sharing with us, as well as to help us understand the growing health concern and the steps we can take to manage CRM better. Cardio-Renal-Metabolic diseases, that reminds us just how connected our heart, our kidneys, and our metabolism truly are, and why prevention begins with early awareness, education, and action. I'm Jessy Chahal. You've been watching The Nation. I'll see you next time. Bye-bye.